Hello students, this is a video describing dissection for the cats so that you'll know what to expect from the very beginning when you first meet your cat. The first day that you get your cat, it'll be in bags like this. It's double bagged. So you'll want to take your cat out of the bag. That'll be your first task. So you'll do that. And when you cut the bag that the cat is in, there's going to be some fluid in the bag. So you're going to want to discard that fluid. Your teacher will tell you. And by the way, save the bags, because each day we're going to need to bag it up and put it in our boxes to store it away, because they'll be kept in the classroom. So you'll need to put your cat back in the bag. So when you cut the bag, find the end of the bag that has the most space and use your scissors on that part right at the end. So save as much of the bag as possible as you're cutting it. Now remember, there will be some fluid in there, so you don't want to do this at an angle where it can drain out. Better to do it where you can have control of it, and then your teacher will probably have a container to gather the fluid in so that you can dump it off into there. So that'll be the second thing you want to do. So I'm just going to run out the fluid into the bag, out of the bag. And then I'll be ready to see my cat for the first time. Move the fluid aside. Now your tray here has edges to catch any extra fluid, so if you have a lot of extra fluid, you can always let it run off into your tray. Now, you might want to put on gloves before you do this. I didn't. So I'm going to go ahead and get some gloves, and then I'll come back and join you right here. Alright, I got my gloves on now. Since the cats are preserved in a chemical called formalin, it's kind of a more diluted version of formaldehyde. You probably want to wear your gloves all the time when you're handling them. So I put my gloves on, and if your gloves don't get really dirty on any one particular day, then you might want to save them, because we only have so many pairs of gloves. So your group will have a box which your cat will be in, and you'll be able to save. If your gloves are fairly clean, you'll be able to save them till the next meeting. Okay, so I got my cat bag cut, and I drained off my fluid. There's still a little bit more coming off here, so I'm going to go ahead and pour that out real quick. Because it'll continue to drain out of the body of the cat as you move the cat around a little bit more. Alright, still draining. Alright, now I'm going to go ahead and remove the cat from the bag. This will be my first time seeing the cat. I'm pulling it out just by the legs. This is the way to do it, and just move the bag. So hold the cat's feet and just pull the bag out from under it. And remember to save the bag. You want the bag each time, each day to bag it up into. Okay. So here's my cat. This is kind of a large one. Now when they put the cats in the bag, they usually put something in the cat's mouth. So I'm going to go ahead and remove that. That's a piece of foam. That'll go in the trash. But it also has fluid in it, so I'm going to go ahead and squeeze that out before throwing it away later. Just going to let it drain a little bit more. So on the very first day, what you're going to be doing with your group is you can choose a name for your cat if you like. You'll also be going over the external anatomy of the cat, and while that happens, you'll be looking at all the features on the outside of the cat, like the name for the paw, each of the teeth, the vibrissae, which are the whiskers, things like that, the pinna, which is the ear flap for the cat. So you'll be, before you do any cutting or anything like that, the first day you'll be going ahead and going over the external anatomy of the cat. So follow your dissection manual. It'll show you exactly what to do as far as step by step. So the first day you'll be mostly on the outside. Now if your group finishes the outside and you've labeled your diagrams for the anatomy, then you're going to go ahead and remove the skin. That'll be your next day to start with. So when you get ready to remove the skin, there should be a place on the cat, probably around the neck area. So in this particular cat right here in the neck, you notice that the skin's been pulled back already. And that's because when the cats are preserved, they have to find some large blood vessels in order to put the formalin inside the cat so that it stays preserved. So look for the places where the cat has already been opened and the skin is already pulled back. That'll be your first place to go. So I'm going to start with that on my cat. I'm going to go in here to the skin, and I'm going to start to remove the skin. I'm going to show you how to do that so that when you're working with your cat, the first day of dissection after you've done the external will be to be looking at the skin. So that'll be first. So let's do that. I'm going to use a pair of scissors for this. So you'll have your dissecting equipment. I'm going to use some scissors. I'm going to use a blunt probe, which is a really good tool for separating things without tearing them, because it's really important in dissection to not start cutting first. Sometimes we use a scalpel, so I'm going to go ahead and get a scalpel nearby too. And they're usually pretty sharp, so you want to make sure when you're using the scalpel that you're cutting away from yourself and also away from the cat's muscles, because you want to preserve the muscles on the cat so that you'll be able to see them when you get all the way down and under. Alright, so I'm going to go ahead and start with the neck, as I mentioned earlier. And this cat seems to have a broken leg. I don't know if you noticed that while you're watching, but it probably got broken in storage or in the process of preserving the cat. So I'm going to look for the spot in the neck here where the skin's coming. And you use your fingers a lot in dissection. So I'm going to use my fingers. I'm going to kind of pull away any tissue that might be connected. And then I'm going to use the scissors to cut back a little bit. And sometimes I'm actually even going to use the scalpel if I notice that there's some tissue in the way that I need to cut. So you really use your fingers and you get in there. You see how I'm pulling, I'm reaching inside the skin and I'm putting my thumb in there and I'm holding it out in a way. And as I create a space, then I'm going to cut that skin that's not involved, going this direction away from my incision or where I made my cut. Sometimes, since your cats are pretty large, you might want to have several, more than one person working on this process. And maybe one person, if you see an opening in the hind leg anywhere, one person could start back there so that you can speed this up for your group, because you'll be working as a team. And I'm not going to show them all. I'm not going to show you all of this, but I'll show you how you get started on it. So again, I'm separating. I'm using my fingers to separate the skin from the underlying muscles, and then I'm making a cut. So I definitely don't want to cut first. I want to separate first because I want to try to get the muscle away as much as possible from the skin. So I'm going through the back of the neck here and looking for a place to get under the skin by separating it. And you kind of have to be rough when you pull it. You have to pull the skin away. So it's not something that happens just by barely touching it. You have to be vigorous and pull the skin. So now I'm going to make a little cut down the back here as I've opened up another space. And I'll roll it over for you to see in just a minute. Now one thing that you'll see as you open it up, of course the hair's coming here. Again, as you pull and move your finger or even the blunt probe, you can pull back. There will be fat there, and the stuff that's white that looks kind of like spider webs, that's what's called fascia. Now right here, you notice on mine there's some pinkness there. That's actually probably a piece of muscle that I've separated inadvertently, mistakenly, as I was pulling my skin off. So sometimes that'll happen. So if you see a piece of the muscle kind of attached to where you're working, try to get that loose and leave it behind so that you don't pull off the muscles that you're going to want to view later. So what I'm doing is I'm trying to get that muscle and put it back onto the animal so that I don't take off more of it with the skin as I go. And again, I'm putting my finger, I'm separating, and I'm pulling down. And sometimes you might need your scalpel right here a little bit maybe. You see how I do this? I'm pulling down, and then the space I make, I'm gently using my scalpel to run over it so that I don't cut up everything underneath it. I'm just gently freeing the skin from the muscle and the other tissue there. So here again, there's something attached, so I don't want to cut that. I'm just going to try to separate it off gently. Maybe a little bit of a cut, and using my finger again to try to keep that muscle on the animal and not on the skin. There will be some pieces that will come loose. Okay, now I'm going to work from this direction a little bit. Again, I'm pulling, I'm putting my thumb underneath, and right now my thumb's about up to here, which means that I can go that far with my cutting without damaging the cat. It's almost like you're taking off a coat. You're gently looking for a way to get underneath it. And a lot of times, like right now, I'm just able to tear it back. The white that you see here, that's all fat, adipose tissue. So this cat's got a lot of healthy fat on its right underneath its skin. We call that subcutaneous. So you see how I'm pulling, and then I'm using my hand to kind of separate that area. And you'll get used to it as you go, trying as much as possible to keep from harming the underlying muscles on the cat. Okay, it's opening up pretty well now. So I'm going to go ahead and do that all the way around the whole animal. I'm going to want to leave, you can leave the paws. So if you come all the way down to the limb on the forelimb and just leave a little ring around the paw. Same thing with the neck, you can make a ring around the neck. We're going to do the neck muscles at some point, but you'll be able to dissect that later when you get there. The tail does not need to have its skin taken off, so if you want to leave a ring around the cat's rear hind region, the genitals. Same thing with these lower limbs, you can pretty much make a ring of skin right here around and leave the paws intact with fur. Okay, so you're going to want to do that all the way through. So I'll continue on with mine and I'll let you visit it later when I've got it done. I'm back. Just want to show you what I've done so far and a few more things. So I freed all the skin along the back and I worked forward. And on this side, I freed all the skin as I was making my way down. Now here again, on this particular animal, there's a lot of fatty tissue. So here, if you see on this edge here, I'm gonna have to use my scalpel to pull the skin back. And gently along the edge of the skin, if you run your scalpel along there where the fat's attached, it'll come loose. And then you can keep pulling a little bit as you go to free the remaining skin. Be careful that you're using just the tip of the scalpel as you do that. Just the tip along the edge of where you're pulling from. Don't be afraid to pull it because you're going to need to free the skin. So pull it back, and then you see the white material there that's fascia basically. It almost looks like spider webs. And you just kind of give it a little cut as you pull, gently pulling. As you pull, you're going to see it come off a little bit more each time. Trying hard not to cut the underlying muscle. This is the muscle right here, the darker part. Okay, so pulling, leaning it, holding it back, and then using your scalpel right on the edge there. That's the part you're going to want to do. And then here as I get around the tail, I'm cutting and I'm going to leave the tail and the anus of the animal and just take the skin off of the lower limbs, the hind leg, and about right around here I'm going to go ahead and at the lower end of the hind leg, I'm going to leave a little ring here for the around the ankle, what would be the ankle. So continue to free the skin as you go. Here I'm all the way free all the way up to the front here, and notice again a lot of fat on this particular animal, so I'm going to need to be careful as I work my way through. Now some of these muscles are actually attached to the skin, so there's not much you can do to try to keep them on the animal, so don't worry about that. But you want to be particularly careful when you get to the belly here. Notice in the belly of the animal, you don't want to cut into the abdominal cavity. So you want to be real careful as you use your scalpel on this edge to again hold just on the edge there, just gently, ever so gently with your scalpel or your blunt probe, just cutting just a little bit and then moving it again and pulling it and cutting just a little bit more so that you can work your way in there. It's better to do a good job with the skin and take your time. That way underneath you'll have a better view of the muscles when you get there. So looking for each edge, separating. So once again, this right here is a big chunk of fat, so I'm going to have to leave that with the animal and continue to remove the skin until I catch up to where I am, which is right about here in the middle. And then I'm going to find myself again and be able to separate using my finger, using my scalpel, pulling back the skin as I go. So continue that until you have the skin removed, and it may come off in pieces at times. At times you might have a piece of skin coming off, and just keep a pile, and those will be kept. Since they are treated with formalin, the chemical, we're going to go ahead and save all of those pieces. At the end of the year, they get picked up by a company that disposes of them properly. We can't throw those things in the trash can, so you'll go ahead and save those, and there'll be a container in your classroom to put them in. All right, I'll continue on. All right, today we're going to work on the hind leg. So now that your cat is skinned all the way and you've removed all the skin, you're going to turn your attention to the lower leg right here in the thigh area. So the first thing you're going to want to do when you're looking at your cat is you're going to want to look for indentations or lines that are already formed there. Can you see that line between this muscle and underlying muscles? So what you want to do is you want to take your blunt probe, which is a really very important piece of lab equipment for dissection before you even cut anything. And you see how I'm just going right along that line there where I see the difference between the dark and the light? That's going to be a muscle. So I want to go carefully right along that line, and I want to free the muscle below it. Sometimes you'll have to be almost pull with the blunt probe while you're doing that. So I'm being careful not to cut the muscle, but I do want to separate them, the muscle right on that line where I see a space. Now this right here that you see, that's the femoral artery, and that artery divides two groups of muscles. So right now I'm isolating this top one. I hope you can see it. And you see how I'm going gently lifting it and pulling apart again that superficial fascia that we talked about last time. Now here it's grabbing, so I'm gonna get a little bit of a scissors here, and I'm gonna go right along here in that same place. Sometimes, again, as I mentioned earlier, you can put your hand underneath and help to free that muscle. But right here it doesn't seem to be moving, so I'm gonna make a cut gently right here without cutting the very dull pair of scissors. I'm gonna try another pair. Hang on. Without cutting the muscle, I want to go ahead and cut. Can you get a good view of that too? Okay. I want to go ahead and cut that in between connective tissue there, so I leave the muscle intact. Just gently right along this edge. You want to be really careful when you're using the scissors or the scalpel not to go too deep, because when you go deeper you're going to cut underlying muscle. So now again I need to take that fascia, just gently separate this muscle. This muscle that I'm working with here is which muscle? If you're looking at your diagram on page 35, which is where the hind limb is found, you're looking at this muscle here, which is the sartorius. So I have sartorius there, and then one down below, more inferior is going to be the gracilis. So those are the two muscles I'm isolating right now. So I'm using my diagrams and using my cat, and I'm looking at what I see here. So what I want to do is I want to get my finger all the way under it, and I want to go all the way over to the far side here too, where it seems to be the edge. Now my cat has a lot of fat. You can see this extra fat here. So every time I run into a big glob of fat, you're probably going to want to pull that loose. And because it's adipose tissue, it's not connected very well, although sometimes can be real slippery. You'll probably end up having a little pile of extra fatty tissue nearby if you have a cat that has a lot. Look at all this. All this is extra fat on the outside of the cat, and this as well here. So I'm going to end up pulling off a lot of fat while I go through the dissection to get to the muscles down below. So this cat had a lot to eat, obviously. Same thing here. You see all that? That's all fat that I'm going to have to take off before I can see the underlying muscles. So back to my inner thigh. So again, I'm looking at my sartorius, and I want to reach under to find the back of it without, I'm going to pull off again some fat. See how it just kind of comes loose really easily? Just pulling it loose. maybe a little bit more here. So what I did here was I isolated the sartorius muscle, and I went to the back so I could find the whole muscle. And I need to find now the gracilis muscle, which is the next one here. So I'm going to go along the femoral vein. And again, I'm looking for an edge between two muscles. And I showed before about how this cat has a lot of fat on it. So, all right. So here's your sartorius, and here is the gracilis. So those are the superficial muscles on the lower limb. And on one side of your cat, you're going to want to dissect those, the gracilis and the sartorius, and leave them intact and cover. And on the other side, you're going to go deep on this side. So on that side, you're going to need to make a cut at the end, either this end or this end, and lay the muscle back. We say that reflect it. We're going to reflect the muscle back. So let me go ahead and make a cut here at the middle, or the end of the muscle, I should say, with my scalpel or with the scissors, whichever works the best for you. Get your finger underneath it so that you know that you're not cutting anything important underneath, any of the underlying muscles. So I'm going to go ahead and cut through that. And then once I cut through that, I can reflect the muscle. This is the sartorius muscle, pulled back. Okay. And I have my gracilis muscle. I'm going to do the same thing here. I'm going to free it here at the edge. Maybe you can see this white part here. That's going to show me the line between the muscle and the muscle below it. So I'm going to make a cut right on that white section there. I know I've kept my muscle separate. And now I have my sartorius muscle reflected and my gracilis muscle reflected. Now again, I want to go ahead and carefully, gently cut that superficial fascia that's in the way on both sides so that it lays back nicely. All right, then underneath here, I'm beginning to see some other muscles. What you'll notice is you'll see an open gap, and then you'll put your probe into there, and you'll see some more superficial fascia, and you'll begin to isolate those muscles. So here I have a set of muscles. I'm going to check my diagram in a minute to find out which ones they are. And same thing over here. I want to go ahead and get that natural line. I'm looking for a hole, a space between the muscles. And then I'll use my probe to separate that, or maybe even my finger to separate that. See here, I have a little edge that needs to be trimmed, or maybe just pulled a little bit more so I can open that muscle up. So you'll notice inside between muscles that you see that white, almost looks like spider webs, where you have the superficial fascia there. All right, let's find out what these muscles are. And also there's another one down below here. If I notice that white line, where I can see a line between muscles again, and some fat also, I can find the edge. See that edge? I don't know if you can see that. Let me get my scissors. Tip up a little bit so you can see better. What? Right here. These are the dull ones. The sharp ones. Right here. There's a line which allows me to see that last muscle. And this is actually a big glob of fat that's adhered to the back muscle here. So here's one muscle, another muscle, another, and another. Let me take a look at my diagram of the, can you see that okay? Compare what I see here. Looking at probably right about here, I see that I have, this muscle is called adductor femoris. So right here, this muscle, adductor femoris. Right below it here, you have the semimembranosus, and this one down below, that's the semitendinosus muscle. So semitendinosus, semimembranosus, adductor femoris, those are all on your list. And then I also need adductor longus, which is going to be a very small muscle right at the top here. I believe that will be this muscle right here, adductor longus. Adductor femoris has two pieces. So when I'm looking at it, probably both of these, depends on the animal, are probably adductor femoris. And this one, adductor longus. Let's go ahead underneath the sartorius now, and let's see if we can isolate the muscles here. Alright, so over here, what I'm going to do is I'm going to, again, look for natural lines between the muscles, and I'm going to go ahead and pull that top fascia out of the way. And right here, I don't know if you can see, as I see, a very shiny, you see this very silvery, shiny muscle here? That's actually part of what's called the tensor fascia latae, which is on this diagram, if you look at it, is on the far side of which we call lateral on the animal's limb. And so notice a natural line here as I start to open that. Natural line between those two. And just give it a little pull there. And over here, I'm looking for natural lines so I can isolate muscles, and then I'll be able to determine what they are by looking at my diagrams. And put my finger in there, get that one. So if you put your finger in there or a probe, notice how I did that? I can actually put it all the way underneath the muscle. So what I'm getting here is I'm getting that whole muscle pulled out, so I know I've isolated one. And then you can go ahead and check your book so that you'll be able to find out what muscle that is as you do it. Let's see, there's another one under here. I see a natural line here. I'm kind of going right along that line. Bye. And I'm going to get under it and isolate that muscle. Again, just as I did the one before it. And there I have another one. So it's not that pretty when it comes to this spot right here. But underneath I can definitely see I found another muscle. So I have one here on this edge. Okay, so I believe what we have is tensor fascia latae here. If we're looking at our diagram, where are we? Tensor fascia latae would be the first, which sometimes gets cut back. And then you have rectus femoris, which is this one right here. And then you have, vastus lateralis, which is the middle one, and then rectus femoris. So tensor fascia latae, vastus lateralis, and rectus femoris are your three muscles in line here. And then you're going to go through and notice you have your femoral artery right in the middle. Femoral meaning femur. So you really isolated pretty much all the muscles that you needed on your list. Let me see if I got them all on my muscle list. What do I have? Sartorius gracilis. I did. So that takes care of the hind limb. All right, very good. So we will continue on. We will begin to look at the dorsal view next time. Thank you. Okay, class. Well, today we're going to work on the hind limb, but we're going to be working on the dorsal view. So we're going to be looking and dissecting the rear of the cat right now. So again, first thing I want to do is I want to look for a muscle. Hopefully you can see this brownness here. That's going to show you the edge of the muscle. So I want to find right about in here. Get my blunt probe, and I'm going to go right along this line here, and I'll be able to separate that muscle. That muscle, according to my book, is biceps femoris. On the cat, that's a really large muscle. So I'm going to just dissect right on that line that I formed where I noticed there was a dark and a light place. And again, I'm going to separate off the fat. There's a big chunk of fat here. So I'm going to look for the muscle itself. Going to just do a little bit with my scalpel right here because I have a few pieces that are stuck. Now I'm reaching underneath the muscle. So I'm going to reach underneath the muscle. And my finger's right about here now. So what I'm going to do is looking for the edge of the muscle where it's dark and brown and then it's not. So right around here, I'm probably going to have to end up making a cut there with my scalpel, but I want to get underneath it pretty well so that I know exactly where I'm cutting. Let me just see here. I'm kind of pulling on the muscle to hopefully notice and see where it's divided. So that's all one muscle. That's all the biceps femoris for this cat. So I'm going to take my scalpel and go right on the outside edge of that. Hopefully find the edge among the fat here and fascia. And right along there is the end of that muscle. You can kind of see as you're looking the difference between the muscle, which is more dense, and then the next connective tissue next to it. So that'll help you to determine the line where you should do your cutting or tweezing or whatever it is you need to do depending upon your particular animal. In this animal, that's very tight fascia there, so my blunt probe might be able to help me free it a little bit as I go and separate that muscle out. And you can hear that I'm kind of pulling again to separate the muscle from other muscles behind and under. Under here, I'm actually getting into some of the muscles from the front side. They wrap around. So that muscle right there, that large muscle on the cat for jumping, that's the biceps femoris according to our diagram. Now we need to look for on the back the gluteus maximus, which is very small on cats. It tends to be right around in this area. There's the gluteus for this cat probably. I need to dissect a little bit more and I need to remove off the fat and the fascia on top to get down to the underlying muscle. So I'm going to go ahead and do that by again pulling with my blunt probe. Sometimes the tweezers will work well for that as well, kind of pulling off that fascia, very tight white connective tissue on the top, and then also just the very loose adipose tissue that's there as well. So as you're working through those with your dissection, underneath that you're going to see this muscle right here. That's your cat's glutes, believe it or not. The gluteus maximus. I know it's much larger on a human. For the cat, that's their gluteus maximus. So I'm going to continue to work to dissect that muscle away and be able to find it. But if you take a look, there's a line here separating it from another underlying muscle. And you can see, if you look here, a really big hole that's isolating that muscle from the others. So as I kind of push around, move my probe, and notice the edges of where that muscle lies, I have found right there the gluteus maximus muscle on the cat. Maximus. I also have a gluteus medius muscle, which is probably right above here. I'm going to go ahead and take a look, see if I can find that. I'm going to do a little cleaning up here and then I'll come back and let you know what muscles we have. Legs one more time and making sure we have those before we move on. So this large one here, superficial muscle, that is sartorius. And then we have the gracilis. And then inside here we have the farthest one down at the bottom, that's semitendinosus, semimembranosus, adductor femoris, and then this one is adductor longus here at the top. And then here around the back, the calf muscle, that is the gastrocnemius right here in the back. And of course the calcaneal tendon at the end here, which connects to the heel bone or the calcaneus. And then underneath here, underneath sartorius, the deep muscles there are tensor fascia latae, which is this flap sort of muscle that goes around to the back. And then you have vastus lateralis, and then you have rectus femoris, and then vastus medialis here. And then turning over to the dorsal view, this muscle that I cut a little bit of, that's tensor fascia latae as it wraps around. This is the large biceps femoris muscle here. And then over here you have the glutes. Remember we talked about last time that there are two gluteus muscles. In your case, you your chart just says gluteus, so you can go with either one, but you have gluteus maximus and gluteus medius here. Okay, next we're going to go ahead and start looking at the thorax, ventral view. You want to take a look, just we're having our sign there. And we're going to start dissecting muscle number 15, which is the rectus abdominis we have, and external and internal oblique. So rectus abdominis is really easy to find. You know that it's going to be right here along rectus, meaning basically parallel or flat, is going to be right along the belly. So that's the rectus abdominis. It's covered by a big sheath that's all this whiteness here. You might be able to look underneath that. If you're careful, you don't want to get into the abdomen yet, but it's not necessary because you know that that muscle runs straight along the belly here. This is all rectus abdominis. But to the side, the muscle you're going to begin to isolate here is the external oblique. And it's very easy to see on most of your animals. You see this little edge here where you see the dark and the light? That is the external oblique. So if you just find that edge and put your probe underneath there, again, you want to be careful not to get into the body cavity. Your finger or your probe underneath there and just make a space. You want to go along the edge of the muscle, so you might need your scissors to just gently cut right along the edge of the muscle without getting underneath it. I wouldn't recommend a scalpel here in most cases because you need to be really careful not to cut the underlying muscles and into the abdominal wall. The one below it is the internal oblique. So this is the external oblique. So as I isolate that muscle, I'm just going to cut around the edge of it. And the one right below it that you see here is the internal oblique. So external oblique, internal oblique. I'm going to go ahead and try to free that one a little bit more. It's a really easy muscle to find, but remember it's very thin and superficial. So you need to be careful finding it, that you don't tear into the underlying abdominal cavity. Alright, so external and internal oblique. I'm going to go ahead and do a little bit more cutting here, and then our next muscle, we begin to see the pecs. So I'm going to go show you that one. Those should be easy for you to find. Now if you turn your cat so that you're looking at the tummy side, ventral view, and you're going to want to look here at the pectoralis muscles. Now your diagram, you're going to see pretty easily the pecs, and on mine I begin to see here, as you look to see the lines, match it up with your diagram, but I begin to see a line here. I haven't dissected these yet, so this is already fairly separate, as you can see. A line here, I also see a line here, right along this edge. So here's one of them. I see they make V's, there's a V and another V below it. And they're kind of layered, so there's muscles underneath the muscles. So the very bottom one comes all the way down to here. I'll get my diagram out for you to see it in just a minute. And there's one that comes across right here. Let me look for the other one. There's one more in here. Pectoralis minor, I'm looking for the line. All right, just give me a second. I'm gonna go ahead and dissect these until I find the lines, and then I'll come back and show you where all the pectoralis muscles are. And then we'll go underneath and find these other ones as well. Okay, I'm back and I have isolated some muscles for you on the ventral view of the thorax. So again, here we did the external oblique and the internal oblique below it. And then up here on the pecs, we have several pec muscles that you need to isolate according to your dissection guidelines. You're going to be looking at, of course, rectus abdominis is here. And then you have the pecto antebrachialis. So it's a pec muscle that goes right along from arm to arm of the cat. And then the next one down below that is pectoralis major. And then pectoralis minor. So if you can see the V in each case here, you look for a line that is separated. So pecto antebrachialis, pectoralis major, pectoralis minor. And then this one is the xiphohumeralis, which is the bottom tail of the pecs. Now these pec muscles, although I've used my scalpel to help find the lines between them, they're kind of layered. So these are also underneath the other ones, so as you go down. Now you also have along the side here, you have latissimus dorsi, which runs this way at a diagonal along the side of the cat. Now the next set of muscles that you need to get are deep muscles.
which means that you're going to need to come probably, unless you have a easy way to get into the side, you're probably going to need to make a cut right down the middle of the animal, a sagittal, mid-sagittal cut. So I'm going to use my scalpel. I'm going to make a mid-sagittal cut right down the middle here through all the pec muscles, straight along. Be careful when you get to past the rib cage, you'll feel the end of the ribs right about here. You don't want to cut into the abdomen, so don't go that far down, that far caudally. You want to stay up here on the thorax. And then as you do that, you're going to be able to remove the pecs on this side. Probably use your finger, possibly. You might have to pull with the tweezers. See if it's going to come loose here. What I want to do is I want to take those pec muscles off and lay them back so that I can get to the deeper muscles, which are basically underneath the cat's arm here. And I want to be able to find the teres major over in that area, and transversus costarum and serratus. So my next job is to open this up, taking off the pecs on this side so that I can see those deeper muscles. So next time I'll come back with a segment showing you the deeper muscles once I've dissected that. As I lift these off of the rib cage here and gently remove them and lay them back, I'll be able to reflect back the pec muscles, and I'll be able to see the deeper muscles underneath. So that'll be our next segment in just a few minutes. All right. Okay, so we have the pecs. Now I've done my mid-sagittal cut, and I've removed the top pectoralis muscles, and now below we can see the muscles that we need to see here. Remember, this flap is latissimus dorsi, so that's the lats, and these are the pecs here in the front. Now right along the middle here, this is all part of the rectus abdominis, which runs all the way up and down the belly. This little muscle right here that's going sideways, that's called transversus costarum. So it runs across, transverse. Now if you look underneath what would be considered the armpit of the cat, this muscle right here, up along on the back of the shoulder blade, if you feel the shoulder blade, that's teres major and teres minor, and we'll just call it teres major for our purposes because we only need one. And then this muscle right here that looks like a fan, that fans out, a convergent muscle, that is called, geez, I just drew a blank. That is called serratus. So that's the serratus muscle. Serratus anterior would be the similar muscle on the human. So serratus, teres major, latissimus dorsi, transversus costarum, right here running across. Whoops, not sorry, this one right here running across. And then rectus abdominis, and that's it. Right, so we are going to be on the dorsal view of the cat and the thorax, and so we're isolating muscles back here. So the first thing you're going to need to do is, again, looking for lines. On this particular one, I went ahead and made a slight light incision, very light, to isolate this first muscle here, which is actually the flap covering the back of the shoulder blades, and that's called the acromiotrapezius. So the trapezius muscles here are divided into a couple of different areas. You have the, let me see if I can get this so we can see it, the acromiotrapezius, just covering the middle of the back. And maybe you can see as it goes to a V here, this is called the spinotrapezius. And then there's another part of the trapezius up here on the top called the clavotrapezius. So the trapezius is basically divided into three parts: the clavo, the acromio, and the spinotrapezius. So what I did was I went ahead and used my scalpel to cut the skin of the cat, and again scalpel to separate the fascia, so I could go ahead and see this is muscle number 28, the clavotrapezius, up at the top of the neck. And muscle number 25, this is the acromiotrapezius. And then
And this one is not on your list, the spinotrapezius, but you do have deltoids on your list. So when you look at the cat, the deltoids on the cat are a little bit smaller. There are actually 2, so you can just isolate yourself in this area when you're looking for them. You're probably going to have to tweeze away and look for lines, but you have the 2 deltoids here. In fact, one of them is called the spinodeltoid and one of them is called the acromiodeltoid, but that area right there is your deltoid muscles. There's also a couple of muscles a little bit deeper here that you're going to need to find. Below the acromiotrapezius, right on the shoulder blade, that's called the supraspinatus. Supraspinatus there. And then the mystery muscle here, I put a pin in. Students often have a hard time finding it. It's called the splenius. If you kind of do a dorsal cut along the back here and you see the muscle that's going underneath the clavotrapezius, that's the splenius. So I put a pin in it here for you so that you'll be able to see it. The splenius on both sides, and it goes underneath the clavotrapezius. Now this muscle here, as I mentioned, is called the supraspinatus. So if you think about the way the cat moves, and on the other side, teres major is on the other side, the supraspinatus is basically the top of the shoulder blade. Shoulder blade. Okay, now we go to the forelimb. Right. And on the forelimb, you only have 2 muscles that you have to isolate, and they are the triceps, which are pretty easy to find. Similar to the human, is going to be on the bottom side, we should call that inferior, the inferior side of the arm of the cat's limb, forelimb. And then you have to isolate a couple different muscles here to find what's called the brachialis. This one right here that goes across on the front, let me double check the name of that. Clavo. So that's the clavobrachialis that goes along and all the way down pretty much, kind of like where the bicep would be on a human. So the next one in, which basically meets at the elbow joint of the cat, that is the brachialis, brachioradialis. And that's the one that you need, brachialis. That's the one that you need to isolate. So brachialis and triceps, brachii. And those are the ones you have there. Now I'm going to go ahead and show you next the head and the neck. Alright, so when you do the head and the neck muscles, you're going to need to take in whatever portion you have left, the skin on the cat's face here, and you're going to need to make a cut with a sharp scalpel, I hope. Basically from the base of the jaw, without cutting the underlying muscles as much as you can, so try not to go too heavy with your hand. You're going to want to take that skin and fur off all the way up to the base of the jaw. So that's what I'm doing right now. Scissors might help. We'll see how that will work. I'm going to make a cut straight through that line, hopefully with a sharper pair. That happens pretty much every time, doesn't it? So all the way up to the base of the jaw. And then again, I'm going to pull it back. I'm going to use my scalpel to pull back the skin so that I can get to the muscles that are underneath here. Just a real light hand with the scalpel, and you can pull as you're doing it, and you'll be able to remove that skin. Should probably turn off that fume hood. It's loud. Let's see what we got. Are you filming still? Okay. All right, now there's some muscles in here we need to know. So right up along the base of the jaw, I hope you can see this white part here is the jawbone. You can tell when you touch it with your tools. That's the jawbone. All right, back to the neck. So once again, I took the skin off all the way to the end of the jawbone, and I laid back the fur, and now I'm looking for the muscles on my list. I have number 32, the masseter. The masseter is basically the large chewing muscle. So right here, it's going to be a big round knob on the side of the cat's jaw. So that's the masseter there. The digastric, in this cat, it's really not too pronounced, but if you look at the white, that's the bone. Right next to the bone, that's the digastric muscle. It runs along both sides, here and here, of the jaw, bottom jaw of the cat. So that's digastric, that's masseter. And then you have a couple other muscles you need to know, and depending on how chopped up your cat is on the front, because remember they made an incision here to do the cleaning out of the blood vessels. So on my particular cat, it's pretty chopped up. This dark, normally it'll go down like this, right across the trachea. And that's the sternohyoid. Remember the hyoid bone being that bone in the vertebral column that is in the front there by the neck. And then around the side, the one that joins up in the back, remember we had here the clavotrapezius. Here you have what's called a sternomastoid. It comes along like this, almost like a collar on the cat. So this is sternomastoid, sternohyoid, digastric, and masseter. Now we're going to go ahead and actually open the cat up and start taking a look at the internal organs. So I'm going to use my scalpel first, and you want to be careful on the neck here as I take the pin out of the muscle. You want to be careful on the neck here that you don't cut the trachea as you go through, and maybe you can see on mine, I'm going to go ahead and separate right down the middle. You can probably separate the sternohyoid muscle right in the middle here, or maybe on this side on mine, and then you'll start to see a little white tube. That white tube is the trachea. The first one you see is the trachea, and if you look particularly here, you're gonna see the little cartilage rings. You see how the trachea has little cartilage rings, and follow it up with your finger. The top of it is going to be very firm. That's the larynx, or the voice box. So humans, that's where we make our sound. Same thing with cats. So the larynx and the trachea. Now as you go down a little bit more with your separating and a little bit of cutting, just be careful that you don't sever the trachea as you do so. Right below the trachea, if you move the trachea out of the way and tweeze in, right below the trachea you should find the esophagus. Now the esophagus is a hollow tube, so it's going to look like a flat, you see it under there? Let me get it out for you. So I'm putting my probe right below the trachea, and there's a white looking tube. It looks flat. That's the esophagus there. So right below the trachea. So it's trachea, esophagus, larynx, which is the voice box. And then you want to cut into the sternum. Your scalpel may be sharp enough, but you might have to use a sharp pair of scissors, or maybe even the bone cutting scissors if necessary. These are the really sharp ones. So I'm going to go ahead and try with my big scissors here. And I'm going to cut through the sternum because I want to see the heart and the thoracic cavity. This is going to be next coming up. So right down the middle of the cat, you can go ahead, and it would be possible to come both directions, so you might want to make an incision here starting this way and work your way up. Same thing with the abdominal cavity. I'm going to go right along the belly here. Just a really light cut. Some of you already did nick into the abdominal cavity while you were doing your muscles, because it's very, very thin. That rectus abdominis muscle is very, very thin. Okay, so I'm going to go ahead and open it up. Take my scissors rather than my scalpel, that way I can be careful with my finger lifting up not to cut the underlying tissues. There's a lot of fat with my cat. See all that white coming out? That's all fat on top of the organs. Now as I'm getting to the sternum, you're going to notice that it's very tight right in here. You see the abdominal cavity, and when you begin to go in the thoracic cavity, the diaphragm muscle separates those. So you're going to have to, in some cases, maybe even cut into the diaphragm muscle. Sorry about that. Big noise with the ribs as I'm opening them up. Not for the faint of heart. All right. So now I'm beginning to see the internal organs. Let me see if I can get this loose a little bit better on the sides. There may be some fluid in here from the lungs. Remember, all the internal body cavities are very wet and moist all the time. So right here, this is the thoracic cavity, and these are the lungs. One lung here and one lung here. One side of the lungs has 2 lobes and one side has 3. That's normally supposed to occur. This is the heart, and you may not be able to tell, but it's surrounded by a sac. The sac around it is called the pericardial sac. So at some point when you get a chance, if you want to look specifically at the heart, you'll have to remove the pericardial sac to look at it. Now right below the heart and the lungs, you see that the 2 cavities are divided by this muscle. That's the diaphragm muscle. Now all this green here, that's because of the gallbladder. We'll get to that in a minute. But the diaphragm muscle divides the 2 cavities. So I'm going to make just a little cut on one side to keep the diaphragm muscle intact so that I can see it with my dissection. So there it is, that's the diaphragm muscle, and that's where breathing occurs. The diaphragm muscle goes down, the lungs inflate. It goes up, the lungs compress. Okay? This large organ right here in the middle, that's the liver. And this organ on top of it that's green is the gallbladder. Yours may or may not be bright green like mine is here. So the liver is a huge organ. Now if you look below the liver, all of this that you see here, this is intestines, but there is kind of like a fatty mesh-like net that covers the intestines. That's called the greater omentum. So when you take that out, sometimes it's a lot more white. This one has a lot of residual like blood vessels and stuff on it. Then you see what's called the greater omentum. The job of that is to cushion the stomach. So follow the greater omentum up and you'll see the stomach. So this is the stomach right here. Later, if you have time, you may want to look inside and see what your cat was eating, if anything, prior to its life ending. So that's the stomach sitting right attached to the greater omentum. I'm going to move the greater omentum aside. Now right below the stomach here, this large organ that you see, that's the spleen. The spleen is really large. Okay, these are the intestines, small intestine, and this right here that holds them together, that's called mesentery. It looks almost like plasticky substance connected by blood vessels and so forth. So that is small intestine. Here we have the large intestine that follows below the small. Okay, I'm looking for the pancreas. The pancreas resembles the spleen, but if you notice, it's right here along the back of the greater omentum. It's much smaller and it has a marbled appearance. Kind of looks choppy, as opposed to the spleen, which is larger and more smooth. So that's the spleen, that's the pancreas, small intestine, mesentery, large intestine. If you follow it through, here's the large intestine. Okay. Now also to be noted, you have part of the liver here. This is a kidney in the back here. So if you dissect that out a little bit, you'll see the kidney itself, which is usually surrounded by quite a bit of fat. And then the small little tubes that come out of the kidney, those are the ureters, and they bring the urine to the bladder, which we're about to find next. The bladder, in my case, in my cat, is a very small little round ball right here. That's the urinary bladder. Some cats, if they had a full bladder or still had some urine in there, it'll be bigger and more enlarged to it. Mine is pretty small. That's the urinary bladder. Let's see, what else here? Do you remember if my cat was a male or female? My cat's a female, so we should be looking for some female reproductive organs in here too. Give me just a second. I want to get this liquid out of here.